Good afternoon and happy CX Day. Welcome to this year's CX Day celebration. We, customer experience professionals across the globe, celebrate CX Day every year on the first Tuesday of October. Welcome once again to all of you in this webinar. In this webinar, we will touch upon the how customer experience can be used for a resilient business in pharmaceuticals, healthcare, and life science companies. Very happy to see that a lot of people have joined this webinar. And this program is one of the official event of CXPA Global. As of now, we don't have any India chapter. Possibly today we will be able to converge and establish the India chapter of CXPA also. But let us come to the point of this webinar. This webinar is for the healthcare, pharmaceutical, and life science companies. Let me show my couple of slides here. So what we'll do, will not be able to uh, enter into the question and answer session in the beginning, maybe last at the end, if some questions are there and we have time, then we'll try to approach that. But my idea here is to give you a brief orientation about the customer experience and how it can be helpful to you, to your organizations, right? Let's move forward. All of us has experience which is very fluctuating, whether be as a customer or as a business about our customers. We know that it happened some time back, I think more than 20 years back experience, where a bunch of senior customers has been sent to attend academic programs outside the country. They were very happy because the content of the program was very good, with the authority of the subject were presented there. We came back, most of the doctors were very happy, and they started prescription to the company. What happened, one of the particular customer who was earlier a good prescriber for that company suddenly stopped prescribing the product. Everybody in the organization were there. What happened? They went to that doctor. They asked, initially he refused to meet, but when the senior regional managers went to meet him, he revealed what happened to him. While he are coming back, his pickup vehicle has not reached in the wee hours around 3 o'clock in international airport, and he was furiated. He was made to wait a couple of hours. By the time he actually departed from the airport, it was day. And that was the simple reason. He was very saying that very bad experience, and he actually stopped prescribing. And this is not a new, you experience that, whether it's the medical reps experience with the doctor, or sometimes somebody go and say something, and you know that what happens to the customers. So what is customer experience here we are talking about in as a faculty, as a discipline, is that customer experience, we count it all the experience. It is not about in-clinic experience with your medical rep, with a doctor. It is also about how he experienced your company while attending a Zoom call, while attending a seminar, a CME, while attending a conference, or even getting a mail from your senior management. One of the doctor has forwarded a mail sent by the company to his regional managers, who happens to share me also that the mail which went to the doctor, a very senior cardiologist, it was addressed like "Dear Vendor," and there was a lot of different matter there. So doctor was furious being called as a vendor. And you understand that how it could happen. And this mail was not sent by the sales and marketing team. It was sent by the SCM, supply chain management team. Ultimately, the doctor, the customer, is of a business, of an organizations. So this fluctuation happens up and down, up and down. Customer experience faculty here, customer experience discipline here is aimed to map all those experience, virtual or the physical or done by the sales marketing or other team across the hierarchy, map it and try to ensure that each time every customer get a positive, a good wow experience. And if you are able to manage that, you know that the impact of that, it is not something difficult to anticipate, right? So there is a, of course, there is a very clear, defined definition for customer experience, which Customer Experience Professional Association. I'm one of the proud member of CXPA for last couple of years, and I actually leave this definition for multiple years here in this industry. Right. So it is the sum of all the interaction across the channel. It is not about the medical rep only, about across the channel. And it comes from the customer's perception. It is not about what you are doing, it about the what customer is perceiving. That becomes the more important part here. And it is not difficult to understand that these perceptions either strengthens sometimes or sometimes detracts the brand value through the relationship, the overall brand consideration in the market in totality. That's the brief definition about the customer experience. Why we are talking about the entire journey? It is not one time delighting the customer, rather the entire journey. When it's a journey, it is about before customer interact with your medical ref, how he know about your company, in the media, in the newspaper, that is the PR, public relations effort. Those things also impacted here. So this study is published here, which says that if you focus more on the customer journey rather than just a touch point where the medical ref interact with the customer, your output will be more. You will be getting more impact in customer satisfaction and of course the revenue, which we all are working for. There are 6 disciplines identified by Customer Experience Professional Association, CXPA. I'm going to run through broadly what are those disciplines and how it can actually help you to understand customer experience in a much more professional way rather than just individual idea of individual professional here. So the first thing you see here, the customer-centric culture. There are so many anecdotal good incidences happens in all the companies across the geography. The problem is we are not able to replicate the same experience, wow experience, which one medical rep gives to a customer in the different geography to across the customer, across the geography, and to all the customers. So this is because it has to be embedded in the customer centric culture of the company. That's why it is said that customer experience is not the business of the sales and marketing only. It is the business of the CEO. It starts from the top management, and the top management makes sure that the whole function, all the different functions are aligned with the customer centricity of the organization. It is every aspect, every team. It is said, I sometime back I read an book, there it was mentioned that there are only 2 types of employee in any organization. One is called FTM, full-time marketeer, and other is part-time marketeer. So all other functions, it is be it the operation, be it the HR, finance, production, everybody should consider themselves as a part-time marketeer, and they should support the full-time marketeer to give a very high, always, every time, consistent customer experience to your customer. That's why this can be possible only when you work on the customer-centric culture. The second thing here would like to talk about you is that long back in 1998, the first time this term came, experience economy, and you know that how the economic development happened right from the commodity world to service world, and now we are in the experience economy. The companies like Amazon, these are the company are primarily based on the customer experience, right? So and every companies now who are progressive company are under trying to understand the undercurrent and trying to change the whole organization culture to meet the need of the experience need of their customer. The second thing is a very important thing. We in pharmaceutical industry, we believe that we always hear to customer, but if you reflect upon, we usually tell the customer about our brand. We give detailing a story to medical reps, sometimes even to other managers, and they go and then just vomit it, what they wanted to convey for the brand, for the molecule, for the event, for the CME, right? Do you really have a mechanism to capture the voice of the customer? I doubt. Some companies might have, that's good and good to have. Some companies might have in silos, but we need to reflect upon on this aspect to capture the each and every said and unsaid voice of the customer and process it to refine our marketing strategy to go back to meet to offer higher customer value to your customer. That's the second component, second discipline out of the 6 discipline of customer experience as recommended by customer experience associations. Here, this is a beautiful study done by Bain. The organizations believe that these are the things customer need, but when the survey was done, that got shattered. Actually, the modern customer need require and expect efficiency. They expect convenience. They expect the knowledge so that they can do the self-service. They want a friendly services. These are the differences what the companies believe that their customer are expecting, and the reality at the customer end is different. So this gaps exist in the pharmaceutical industries as well. So we need to know that. We need to have a mechanism to really gauge that voice of customer, and then only you will be able to understand what exactly customer is looking for from you. And the third thing is the most and very dear to me is the customer experience design and improvement as well as innovation. We do a lot of activities, be it the conferences, CMEs, many sort of in customer engagement activity based on what we know, based on what we understand that customer needed. Some of the companies very happy to see that they embrace the design thinking approach to know the customer need, what even the customer don't know. Actually, when you ask your customer what you need, sir, from us, you know that the typical answer comes, which you can anticipate. And if you see that over the 20 years of time, this answer has not changed. They will tell you the book, the good CME, the conferences, blah, 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 things, you know that. And the list is very limited, and more or less across the geography, across the customer, you will get similar kind of response from your customer. Have you really given attention to understand the customer's need, which even customer has not articulated it? Customer has not surfaced, not felt this. So there is a mechanism, there is a methodology to do immersion with the customer, living in their context and understanding their pain area, and then developing the services, the product to meet their need. If a company is able to do that, you know that the customer will be more than happy to help you, to prescribe your brand, to more than happy to be with you. So the customer experience design is a further, in addition to innovation, The most important thing is that we need to map the customer journey throughout that. This is about the three aspect of the need: the what is the useful need, what customer want, and how they want to pursue to fulfill that need, and the most important, the purpose, why they. If you are able to know why part, I think your solution will be much differentiated than the others, right? So if you want to really get into the differentiated mode of offering, you need to know the hidden why of your customer, and this can be happen by the study called ethnography study, and a lot of process we apply here to understand that. Once you know that, there is a whole bit of process to actually map the customer's need at different point. It is not a one need is all. A customer actually go through a journey, and that journey and different interaction happens throughout the journey with your email, with your Zoom meeting, with your medical rep, with your manager, with his experience in conferences organized by you, CME organized by you, or any event organized by you. If you are able to map what the need customer want to, or what the want customer want there at the different stage of the journey, if you are able to map it thoroughly, and then think how to redesign it, you get the bullet to the bull. So there is a process we do here to do that. This is a very exhaustive process, and we use certain software, certain technology also to map it in a detailed. And we also not only map from the perspective of the brand. So patient journey mapping is something now the brand managers has been doing that. But while doing that, what I personally observe that they are too much obsessed with the brand, and actually they map the brand journey somewhere that also has interaction with the customer, but it is not from the window of the customer. What CXPA says is that map the customer's journey from his need, his motive, his difficulties, his wow, and somewhere you will find that your brand, your company must be intersecting with that, must be either responsible or doing some positive impact in their experiences, positive impact in meeting what customers need is. So this is mapping is a very exhaustive. When you do in the workshop, the entire four wall is filled up. Still, you feel that there is something to be written. And this is very interesting workshop happens, and this happens for involving multiple stakeholders. It is not about sales marketing. You involve the multiple cross-functional team across the level. It is not the top management only, the front facing people. If you can involve a customer, nothing better than that. That will be wonderful. And it is not writing the text, rather putting visuals, putting graphics, putting videos, and that makes it a rich depiction of the customer journey. And then you will be able to really get insight, deep customer insight. You will be able to identify where the customer experience wow, great positive experience, where customer felt bad about. Sometimes they may not tell you. You have to observe that, and then what are the function, what are the key lever where you need to work upon to make the negative emotions into positive. So this is very interesting exercise we conduct with the team, and to really understand the customer's whole journey here. So these are the points. Actually, I'm not going to read it. It starts with the user goal, and we touch upon the different touch point. Each touch point need to be mapped. What are the processes? And we use here the language which customer use. It is not the business languages. What the languages, the word they have used, it needs to be used here like that. What are the pain point in the processes, and how the experience. The most important thing here we say is that how the customer is thinking, how the customer is feeling. The think and feel part is more important here than the logical reason why and what, right? This is important on that. And while mapping that, the observer used to write, of course, to write a rich description, as well as take the snaps using his mobile, or take the videos with the permission of the doctor, or the wherever you are doing that, actually in a very rich way, and then collect together in the software or in the physical chart paper. I'm very excited about that because it is a very rich experience doing that workshop. I'm thankful for Dr. Professor Vivek Hatangade actually for a small, brief half-day workshop I have done on design thinking. Basically, this is one part of the knowing the customer need, not the full customer journey mapping. And it was done with the senior leaders of the pharmaceutical industry on the Brand Management Day, World Brand Management Day this year in January. So I feel very excited about doing that. So that's why I becomes more passionate about that. So the experience design improvement innovation leads to now the most important thing. And when I talk to the senior leaders of the industry, the most of them asks whether this customer experience will impact to their sale. Of course, definitely. This is why any company is doing that. And there are the data, there are enough data, including pharmaceutical industry data, which says that customer experience not only impact in the short run, but even long run, not only for the mature product, even the new launch innovative product as well. So what are the metrics? How to measure that? Sales is a lag metrics. There has to be some metrics where you should be able to learn well in advance that where you are moving, are you moving really north, what need to be done as a course correction. So there are a list of metrics. Very interesting thing here. One of my friend, not friend actually, he is my mentor. He used to talk about pharmaceutical company invest a lot of time in knowing something where they actually invest less money. You know that the promo budget, a huge amount of promo budget is invested on improving the customer's experience, right? Improving the working on the customers. At the same time, we also buy many data like IMS data or prescription research data to understand the brand behavior, how the brand is doing. This is good. I'm not saying bad. This is good. This is ultimately has to be done. But what he was talking about, he was talking about that are we knowing very early how the customer experience was there for your program you did or your campaign you did. Not about the anecdotal mail or the experience shared by a medical rep as a totality at the organization level, at the chief marketing manager level. Do you know that? Do you have mechanism to really titrate that so that you can change in the next subsequent program? I think this is something we are lagging behind and we need to work in pharmaceutical industry. I will show you some other industries data where they map the customer experience in a score of 100 and they map over the year and they also see how they are progressing. They also see how they are doing vis-a-vis competition, right? So there are metrics. So these metrics will give you ROI, and usually the CXPA talks about the customer retention, acquiring the new customer and getting referral from the old customer and growing the profitability of the company. And this, the Bain company research shows that if simple 5% increment in customer experience gives you 25 and to 90% result in growth in profitability, that's the fantastic part. right? This COVID time, this is a new report published by McKinsey and Company in this COVID time. I'm not going to read it. Anyway, you can later on you can revisit the slides and go in detail about that. But the ultimately, what is the most important part is that you focus more on the care. In this slide, the component of patient experience, component patient as a customer is also included here. So in addition to caregiver, it is the patient as well. And meet your customer wherever they are. And I saw this time in this COVID time, pharmaceutical companies really did marvelous job. Very swiftly, I remember some time back, just 1 year back, when I was pushing pharmaceutical companies to be digital for a digital transformation, they were reluctant. But the COVID-19 made a good thing to industry as well. In COVID-19, actually, uh, commendable job you did, commendable job. The transformation, digital transformation happened immediately. The companies started doing Zoom, and actually not only they improved their comfort level using technology, they made doctors also to improve, to have a comfort level using the so much of technology like video conferencing, doing a webinar, right? And many conferences done by the companies, pharmaceutical companies, for the doctors over the webinar. And even sometimes I saw that the medical rep is detailing products over the webinar to the doctor. So this is what go where your customers are there. This is fantastic job. You have done that. So this is something I thought to note down here. And coming back to what I was talking about, KPI, there are 16 KPI here. I'm not going to go in detail or not going to read it. I just wanted to show you, assure you that it is not only the sales, there are something more to know for pharmaceutical companies, and to leverage different metrics and to do course correction in their strategy, their campaign, their CME, their plan, whatever you do that pertaining to customer experience here. One of the favorite of mine is the NPS. I may talk more about the NPS there. Another favorite is the customer lifetime value, CLV. We know actually this part right from the beginning of our career, but I think there is a professional way. There are more quantified idea and tools here nowadays, which can be leveraged to better profitability, better strategic strategic marketing of a company. NPS is something for a program. If you're doing CME across the India about anything, you would like to know in a very simple language how the CME was, right? And NPS, a very simple measure and very effective, used across the industry. I personally have used in my previous company for CMH. Many of you who have attended are part of the team where I was working, you know that how you have done it. And actually it has been very useful for titrating our future program, future course of action. Right. So here you simply ask the questions to your customer: how likely are you to recommend this CME or this program, this project, this activity, patient program activity to your colleagues, to your friends, and they rate it into 10 in a Likert scale from 0 to 10. So 9 and 10 is extremely likely. And that's most important. And there is a formula to calculate that. If you rate, it can move from -100 point to +100 point. And one way is that you can do it for your absolutely for your program, for your company, for your event, for your patient program. And this can be also done as a totality for a company, and you can compare with how much a score other companies of your industry are getting, and then you can see where you are in customer experience level vis-a-vis other companies. This is what I was talking about. This is not about pharmaceutical company, not even in India. This American Customer Satisfaction Index, as I said earlier, Amazon is a company who are actually leveraging a lot on customer experience. So this index is made called American Customer Satisfaction Index over the year with all the companies. Here you see the primarily this is the e-commerce company here, and they have rated it, and you can see how the ranking is there, and you can see that this ranking is also reflecting the market capitalization ranking as well, right? For healthcare and hospitals, there is a different ranking done under the patient experience level, where you can rank different hospitals. Same way, a couple of senior professionals has been working in collaboration with international body to develop some ranking in India as well, where you can rank different pharmaceutical company as a whole or different a specialty of that uh, company, like for example cardiovascular part of the business of the specific company, how they are ranked vis-a-vis other company, as well as the absolute number, absolute score. And then you can also compare how you are doing over the years, and then this can be a good tool for Indian pharmaceutical industry here. The next is the fifth is the organizational adoption and adaptability. So actually, this is a organization-wide project. One has to, if he really has to get benefit of customer experience, you need to even change your organizational structure. Any of you, if you have attended or would have paid attention to organizational structure of the new age companies, for example, Amazon, you will see that they have totally different approach. Everything is oriented towards customer. I tell you, since Amazon came, a very interesting experience I had with them. Uh, there was a seminar, a whole day program with the senior managements, where Amazon's head, AWS head of India, was presenting, and the different level of senior management was there. I was also fortunate to be there. And when it was asked to him that how you do this here, this is it's a huge difference as a customer we feel when we deal with Amazon in e-store. Even the AWS head of India of Amazon said that, sir, what we do whenever we are in dilemma when deciding anything, we do a simple exercise. We don't decide ourselves. We don't ask our senior vice president or the top of the function for a decision. We do a game. One of us became a customer, and all other functions, all of us decision maker sit around him, and we pose that dilemma questions to the customer, the person who is playing as a customer. If you can get a real customer, that's good. Otherwise, we do ourselves, and then ask him whatever he say, we use it. That's the fantastic, right? They call it customer obsession. Some time back, I saw in their HR portal, the recruitment portal, they have written customer obsession as one of the requirement to apply for a job in Amazon. So these things can happen only from organization if your whole organization adopt it, and the accountability is fixed to every function for delivering high customer experiences, right? And you know, this all can happen only when you have a very robust customer experience strategy. So this comes in last, but actually in practice, this should start. The companies should work, the senior management should work to set the vision statement to customer experience, should work for detailed values for customer experience. So whole strategy of customer experience should be on paper so that whole team is aligned, and then you can deliver the real customer experience and lead to become a resilient company, whether it is COVID or it is non-COVID era. It has been seen that with the real data, the companies who are actually working through customer experience window, they outperform the other benchmark companies, Fortune 500 companies. So as per a strategy, I was talking about which a strategy will best meet the changing need of your customer. So I thought to use this. This is a report published this year itself, and the Customer Experience Professional Association (CXPA), where I'm one of the proud member. This study was done in collaboration with CXPA, and this is they have listed that, and you see here, developing a customer-centric culture is the most important, followed by simplifying the product and processes, and blah blah blah. This may differ company to company, industry to industry, but as a whole industry wise, across the industry, this is the finding which we had with this, and this is published in the report. This is a free available report. You can get it. If you want, getting problem, you can request me, I can send you the report. So coming back here, McKinsey and Company, they have published the CEO guide to customer experience, and they give a challenge to industry that delighting customer by mastering on the customer experience execution, and then exceptionally to deliver exceptionally good customer experience is a challenge, but it is an essential requirement for leading in environment where customer will growing power. You must have seen that earlier, how the power of decision making is shifting from top to bottom, from the manufacturer, marketers to bottom to the customer with this disruptive connected world. This is the visuals. Visuals. Last year, I was invited by Medical Doctors Association. They were doing this ophthalmology conference in Hyderabad, in High-Techs. They wanted to me to talk on the customer experience for the doctor's point of view. We call it patient experience. I had one session there. I have presented them on the possibilities of patient experience, how they can get sustainable inflow of the patient in their hospital, eye care hospital, and can not only improve their profit and business, but also improve the health outcome. Next day, I was participating in a debate, in a panel discussion along with three more senior ophthalmologists who were the CEO of the big chain of hospitals, which was moderated by a very senior ophthalmologist. So it was an amazing experience. I was very happy. Why I'm sharing to you here, I was very happy that to see that doctors are willing to embrace the customer experience methodology. Immediately after this session and in the breaks, the lunch break and the tea breaks, many doctors actually heralded me, asking a lot of questions, a lot of queries, showing a lot of interest to know more about how they can actually leverage this customer experience for their hospital, for their practice. This is why I put this thing here. As I say, there is a rough estimate index also. What you can do, this is not 100% foolproof, but adopted from a model. So you can evaluate your customer experience of your index of your company using this simple tool. And you will, once you log in, you see that who made this tool. I have mentioned the name of the authors from whose model we have adopted here. So just type acpd.live/CXD, customer experience diagnosis, CXD. And then you can go through a couple of questions, and at the end, you will get a score out of 100, just a rough idea about your company in which you are working or you are consulting. You can know about the customer experience level as on date. As I said that in the beginning itself, you can claim, you can get a certificate for attending this CXDay programs, but you have to really be serious. You have to take a quiz. You have to take this assessment. After assessment, you need to score 60% minimum marks also. The PDF certificate will be mailed to you. In addition to the people who are attending this webinar today, this will be available for everybody for the entire month of October 2020. entire month of October 2020. Anybody, even when this video will be posted in YouTube, uh, at youtube.com/academy of CPD, you will be able to you go through the entire presentation, and after the presentation you can take this quiz and can claim your certificate.